Hello, my dear friends. Assalamu alaikum and welcome back. Friends, we are discussing about the fibula bone. So, in the previous lecture, we have discussed about the features, the external features of the upper end and the shaft of the fibula bone. Now, we are discussing about the lower end of the fibula bone in detail. We do record these videos. So, friends, here we have about the fibula bone, the explanation that was included in the previous lecture, about its anatomical position, about the site determination I had discussed very much. Then the external features we discussed in three titles: the upper end and the shaft and the lower end. So these were the important features that I had discussed in the upper end. Then the shaft, we discussed about the shaft of the fibula, and then now we are discussing about the lower end of the external features of the fibula bone. So my dear friends, look carefully. First of all, I had told you that about how to determine the side of the tibia of the fibula bone. I'm sorry. So this sharpest border should be interiorly and this malleolar fossa should be medially, so you can easily determine either this is right or left fibula, right? So in my hand I have the right fibula here. Now let's see about the external features of the lower end of this fibula bone. So first of all, this externally this lower end is expanded anterior posteriorly. Look carefully, friends. I'm holding this bone in its anatomical position, right? Okay, so this is the anterior side and this is the posterior side. So if I turn it like this, right, you will see that this bone is expanded anterior posteriorly. So as I have written there, this bone is expanded anterior posteriorly, but from side to side this bone is flattened. So we have written here it is flattened side by side, right? Then about the features, first of all, the lower end of the fibula bone has surfaces. And how many surfaces? It has three surfaces. And what are those? The first surface that it has is the lateral surface. So we have here this lateral surface here, right? This is the lateral surface on the lateral side. Then there is a medial surface it has. So this is its medial surface, my friends. This is its medial surface, and in this medial surface there are certain important features that we will see here. So this is the medial surface, right? And then there is a posterior surface. So this will be its posterior surface. So you can see, if you have this bone in your hand and you're watching this video, you will easily learn, right? Look, this is the bone and its anatomical position. So first this will be the lateral surface, this is the medial surface, and here will be the posterior surface, right? So the lower end has three surfaces, okay? The lateral surface forms the medial malleolus and has a groove. Look carefully. This is the lateral surface, and this lateral surface, when it goes down, it forms the medial malleolus, right? The lateral malleolus. So this part is the lateral malleolus, and in this bone we have the medial malleolus. In the tibia bone we have the medial malleolus, and in the fibula bone we have the lateral malleolus. So this is how we hold both of them together, right? Like this. So look carefully. This is the medial malleolus, right? And this is the lateral this is the lateral malleolus, and this is the medial malleolus, and here is your foot, right? Here will be your foot. So and these bones are held like this, right, friends? Okay, so done. So the lower end has three surfaces. Once again, the lateral surface forms the medial malleolus, and it has a groove in it. So there is a small groove part in the lateral malleolus that I have shown with the green color, if you can see. So it has a groove, right? And it has a lateral malleolus. Then about the medial surface, it has the articular facet for the talar bone. So here, if I unshade it and if I show you with this blue color, here is a triangular facet present here, right? Here is a triangular facet which is present there. So this is called the talar facet. And if we have here this talus bone, right, this facet, this is the foot, and this is the talus bone, and this is the calcaneus bone, right? So this is the foot, and this facet which is present in the fabula, right, it will make a joint here with the talus bone and with articulate with it. So this is the talar facet in the medial surface of the lower end of the fibula, and the posterior surface is little bit smooth in nature, so there's a smoothness in it, right friends? So what did we discuss? We said that in the lower end there are three surfaces: the lateral surface, the medial surface, and the posterior surface. The lateral surface forms the lateral malleolus and a groove in it. The medial surface has a very important external feature, that is the talar facet in it. It has a triangular talar facet, and then there is the posterior surface which is a little bit smooth in nature, and there are some other external features of it. So let's see these three important points here. Look here, this bone is shown from the lower aspects. The camera is showing it like this, so you can see there, this bone, this largest bone is the tibia bone, right? It is shown in this manner, my friends. It's shown like this, you can see there, right? It is shown in that picture in this manner. So friends, here the largest bone is the tibia. Then here you can see there is the articular facet for the of the lateral malleolus. For what? It is for the talar bone, right? Then you can see here, this is the lateral malleolus, right? And here in this lateral malleolus there is the malleolar fossa. So let me color it here with this black color here. You can see there is that fossa here. In the lateral malleolus you have a very depressed part, and this depressed part is called the malleolar fossa there, right? So there is the malleolar fossa. And one thing more which is very important, which I will show you in the other bone, if I have here, right? Yeah, we have it here, so but no problem, we will show it clearly here. Here is a notch present, right? This is the notch which is present here. So this is called the fibular notch. There are the attachment of certain important ligaments to it. We will discuss later, right friends? So this was about the lower end of the tibia, that fibula bone that we discussed. I'm sorry, I'm making mistakes all the time about the difference between tibia and fibula, so sorry for that. So there is what? There is the lateral surface, the medial surface, the posterior surface. Then there is the lateral malleolus, right? Then there is the articular facet for the talar bone, and then there is what? There is the malleolar fossa, and then here is a notch present there. So my dear friends, this was about the lower end of the fibula bone. I hope you like the lectures, and please, my dear friends, if you like these lectures, please invite all of your friends to this very small channel, so it will be a little bit